I just finished the career pathways assessment. What did you guys get?
Academia? What did you get?
I got academia and clinical, but I'm leaning academia.
I got academia as well.
And what's that about? Because, all right, let's read about it. The term academia is actually used loosely. It doesn't necessarily mean you'll be working in a university. You may be working in the university and then working in a hospital also. So it's a combination of the two. But it's still confusing. I have no idea what this really is about. And it would be ideal if we could get someone to
I think, is Dr. Sabet nearby? Let's...
I understand you guys want to talk about academia. I'd be more than happy to help.
Do you travel like that all the time?
Why, yes, I do.
Dr. Sabet, what exactly do you do?
I'm the assistant professor of pharmacotherapy in the Department of Pediatrics on the campus of Tulsa.
What aspects of your job do you find the most appealing? Like, why would I want to have this job?
Interacting with family and kids, helping with complex medication needs, and assisting providers in selecting the best options for medication therapy. Sometimes I have better resources to help a provider decide a treatment plan for a patient or make patients' lives easier.
Okay, I'm gonna ask you the reverse of that.
Okay.
What is the least fulfilling about this job?
Nothing about my job is unfulfilling, but there are some challenges. Sometimes you know something that needs to be done for a patient, but there are rules preventing you from doing so. For example, insurance companies or other healthcare providers are not doing their job correctly. It only makes my job harder.
So what advice would you give us if we're interested in doing academia?
I would say get early exposure to academia, such as a rotation. This can give you a feel for the job. Sometimes students get aggravated with the way school works, so it is always good to see from the other side. I believe some of the professors here at the University of Charleston offer an academia rotation. If you're looking to do a residency, find one that offers teaching experience. This will provide you with the opportunity to lecture, facilitate labs, or co-precept students. Usually residencies at a school of pharmacy can provide you with these opportunities.
All right, so do you have any ideas to make this profession better?
If you are really pleased with your profession, you will do your best. It is important to be creative and go above and beyond for your patients in the profession of pharmacy. Money will not be enough motivation for this career. Make sure this is something you are passionate about.
Is there a class you love teaching right now? What are you currently working on?
I enjoy teaching pharmacoeconomics.
I like that class too.
I do not feel like this is usually taught in depth, and students do not get the application part of it. It is becoming more prevalent, therefore needs to be taught more. I'm currently working on teaching pharmacotherapy to PA students and teaching medical students how to write pediatric prescriptions. I also teach medical students updates in the guidelines. I do didactic teaching in the clinic with medical students to teach them what kind of medications should be prescribed in different situations.
Okay. One of the drawbacks for any job is, does this job interfere with your personal life? Like, how much family time are you able to get, and are you able to enjoy the holidays and the weekends?
So far, I've been able to maintain a personal life. I've been in this position for just a little over a year. I've had only to work 2 to 3 evenings from home. It depends on how much time you have, your time management, and your expectations. You can always take your work home if you want, but I have kids and a wife, so that is not ideal for me. I want to spend time with them. If it is time to go home for the evening, I put my work away with the intentions of picking it back up first thing in the morning. There are always activities to get involved in at work. For me personally, it was easy to say no to these things because I knew I had children at home I wanted to spend time with. Doing a residency can prepare you because there will be a lot of activities that you cannot say no to. It gives you the opportunity to become more acclimated with the pharmacy workload.
As a pharmacy student, is there anything we should be doing to become the ideal candidates for a career in this field?
Getting to know people in the profession of pharmacy is the best way to get your name out there. Pharmacy is a small profession. Everyone knows everyone. A lot of people want to do residencies, therefore become involved in organizations and take on leadership roles to make themselves a better candidate. However, I think it depends on who you know. There are hundreds of applicants for residencies. All of these applicants have an application that makes them an ideal person for the residency. Most of the time, they will choose the applicant who has been strongly recommended by a friend or colleague. Try to get the best letters of recommendation and get to know everyone you can.
Thank you.
So you all have asked me plenty of questions. Now I just have one question for you. What did you guys think? Would you ever consider a career in academia?
Yeah, what about you, Abigail?
I'm torn between. I'm not sure yet. How about you?
Okay.
No, I don't think so.
No, not for you?
Mm-mm.
Okay.
Well, for me, the positives are being able to be with your family. That really, the nice thing about academia is just having the time, and it seems like there's a good work balance lifestyle to it. And, being able to teach students, you get people who are more inclined to know this stuff, more inclined to want to learn. Whereas I've had some rough counseling before, and if you have a patient that just doesn't want to learn what's going to help them, it can really turn you off. Whereas if you like teaching and you have people that are receptive to teaching, it's nice. It's a nice social, positive. So, what turned you off to it?
I'm just not really interested in doing like a residency or anything. I'm more interested in just
Yeah,
retail.
that's the negative side.
Yeah.
Is the residency. I think if there wasn't a residency, I think there'd be a lot more people in it.
Definitely. Also, if I was going to teach, I would do it more like I would have just become a teacher, like for elementary students. I wouldn't be interested in teaching like at this level, if that makes sense. I'd rather just do retail.
It's a very personal thing. So it's important to know those things now before a decision is made, especially after graduation. So thank you guys for answering my questions or my question, and I hope that I've answered all of yours. So with that being said, it's time for me to go. Goodbye.
Thanks.